Hi, I'm Reed. I'm a student physical therapist here at Midwestern, and we're going to be talking about active range of motion, cervical flexion here with Ray. And so first I'm going to have him just go ahead and try to touch his chin to his chest. And while he does that, we want to look for compensatory factors such as flexing forward at the trunk or going into like a major kyphosis here, excessive kyphosis, try to tuck it, but he did really good there. And now we're going to measure with the goniometer. So what I'm going to do is axis of rotation at his external acoustic meatus. The moment arm is going to be at the base of his nose and perpendicular to the floor with the stationary arm. So I'm going to have Ray go ahead and do it again. Go ahead and lean forward. Excellent. Follow with my axis. Get to where I need to be. And that is 61 degrees flexion, which is good. Normal is 0 to 45. So you actually have a little bit extra there, Ray. External range of motion here for manual muscle testing. So what I'm going to have Ray here do, I want you to go ahead and try to take the back of your hand up to the ceiling as far as you can go, Ray. Excellent, nice. And go ahead and relax right there. So when he's doing that, we're looking for compensatory action. So he's going to be lifting his shoulder off the ground. We want to try to make sure that doesn't happen. And also make sure you support the humerus at a nice level here. That's why the towel is there. So Ray, I'm going to have you go ahead and go into external rotation. And when you do that, I'm going to apply the test. I'm going to stabilize your scapula. I'm going to push down into internal rotation and try to see how he holds it and try to break him here. So go ahead, Ray. Hold, 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 hold. Awesome. Go ahead and relax. That was pretty good against moderate resistance. I'd give him probably 4 out of 5 here. If he couldn't get his full range of motion, I'd put him in gravity eliminated. So that would be for 0 to 2. And they're just having their full arm off the edge of the table and they're trying to take the middle of their forearm away from their midline. And that's how I'd grade for that. So the muscles we're going to be using for external rotation is your infraspinatus, which is innervated by your suprascapular nerve, which is C5. And then your teres minor also helps, and that is your axillary nerve, which is C5, C6, and C7. So, thanks. Hi, my name's Reed. I'm a student physical therapist here at Midwestern University, and we're going to cover, thanks, Ray. We're going to cover upward rotation of the scapula along with abduction of the arm. And so we want to just make sure we have good visual cue on the scapular motion while you go through it. Make sure the patient is seated upright and feet nice and flat on the floor. So I'm going to let Ray go ahead and go through the full range of motion here if you can. Excellent, awesome. So you can go through full range against gravity, so we know that's at least a 3 out of 5. So now I'm going to allow him to go through it again, get him about halfway through, right about there. Perfect. And now I want to take one hand, I'm going to try to stabilize his scap and push into it, while I take my other hand and I grab above the elbow and I'm kind of pushing down and in and try to get him to try to break here. Okay, Ray, so I want you to hold that for me. Okay, here we go. Hold, 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 hold. Awesome. Go ahead and relax. That was a 5 out of 5, real good strength. We're testing the serratus anterior, which is innervated by the long thoracic nerve, which is C5, C6, and C7. And then also we're looking at the upper trap and lower trap to kind of help with that upward rotation of the scap. And that's your accessory nerve. So that's it. So whenever you're ready. All right, and so for gravity eliminated position, like a 0 to 2 grading, I would put the patient in this 35-degree abduction. Scaption position is what we call it, and all you're going to try to do is protract away. All right, so when doing overhead scaption motion, abduction, upward rotation, compensatory things that you might be looking for is a lateral lean to the other side. So what that would look like would be Ray in here, and then you lean away to try to get that extra range of motion. Try to make sure that you don't allow that to happen. Thanks.